Hi, this case is of tooth splinting. As you can see, this tooth is quite mobile. What we need to do, we have to splint this tooth with a wire and we have to attach this tooth to the adjacent teeth so that it doesn't remain mobile anymore. Here a loop is formed around the tooth from the lingual to the buccal, and then as this wire is quite thin, so this can go from the interproximal areas very well. Now in pre-formed grooves on the adjacent teeth, bonding and curing is done so that we can put a composite there and we can fix this wire there. This is a slow process. Patient cooperation is required. Restorative composite is put in the place and this wire is merged with the tooth so that it doesn't impinge over the lower lip of the tooth. With the help of thin instruments, with explorer or with composite restorative instruments, we can always merge it with the tooth. There is a process in which this loop is not formed and only a straight wire is given to the tooth. But as this tooth was quite mobile and we did the procedure when we gave straight wire, but it was not very successful. But by this loop method, as we are giving a lingual support to the tooth, this is a mechanical support also, that something is looped and we are placing the wire, we are extending the wire buccally. So this gives more confidence while doing splinting in single rooted teeth. Again the adjacent tooth is bonded, cured and composite is placed. The bonding agent should be scrubbed to the tooth. Patient also happily accepts this treatment. As this is cost effective, we are maintaining the natural dentition there and we are giving tooth a strength. These three teeth are strengthened, not only single tooth. The teeth from where we got the support also, these are also strengthened. Very importantly, the tooth which is splinted, the tooth which was mobile, should be selectively grinded. There should not be any abrupt occlusal forces there. Take a polishing burr and grind that tooth from the occlusal so that it doesn't impinge over the upper teeth and the occlusal forces are greatly reduced. Checking the mobility again, it is greatly reduced. This extra wire is cut with simple air rotors and the area is polished, cleaned. You can always apply some gels, antimicrobial gels after the treatment if some bleeding is there. Mobility is checked, it is quite splinted and there is no mobility now.